I'm Quincy, and this is my presentation on doctor-patient confidentiality with minors and their mental health. So this topic's important to me because when I was around 14 to 16, I started struggling with mental health, and then when I was about 15, I decided I wanted to go to a therapist to help me. And after a while of seeing her, I decided that it really wasn't helping me, and that I wanted to stop seeing her. Then I found out that my therapist had told my mom everything I told her, and this really shocked me because I thought that mental health was like a very private thing between a patient and a therapist, and I didn't think she could even tell my mom anything. And it made me understand how complex the issue of confidentiality is with minors. And it really made me think that learn that therapists have many things taken into consideration when they're thinking about breaking confidentiality, which is the safety and well-being of a patient and how it's going to affect the patient's life and relationships, whether in the therapeutic world or outside of it in their personal lives. So this is going to go through all the legal and moral issues surrounding that. Background on minors and mental health is in 2023 is reported about 5.3 million minors struggle with mental health issues, but on average only about 28 to 30% of minors even seek help for mental health issues. So that number could be a lot greater than it actually is, which is concerning because this just shows the distrust of therapists that breaking confidentiality has caused over the years. And the things to consider when deciding to break confidentiality or not are the age and competency of the minor, if the minor is in any danger to themselves or others, and how will divulging the information to the parents affect therapeutic relationships in the future as well as their future relationship with their parents. And according to the pediatric emergency care, minors do have the rights to confidentiality when it comes to the following things: emergency care, contraceptive services, STDs, prenatal care, drugs or alcohol care, sexual assault services, or mental health services. And then some consequences of breaking confidentiality: it can lead to the mistrust of medical professionals or other therapists by the minor, and it can lead to a strained relationship on the patient and family members when information is shared. It can also result in not returning to therapy once they find out their confidentiality has been breached, which is concerning because therapy is a great way to help people with mental health issues. It can help people a lot, and if they feel like they can't trust their therapist, then they can't even get the care they need. And then, according to the book Confidentiality in Mental Health, specifically Chapter 4, which focuses on minor confidentiality, there have been a lot of legal developments over the past few decades which have given minors a lot more autonomy in regards to their mental health care. Specifically, it talks about Article 8 of the Human Rights Act of 1998, which is on the right to respect for private and family life, which kind of goes along with how telling confidential private information to someone's parent or guardian can disrupt their private life and family life. So that's something to definitely take into consideration. And it ultimately comes to the conclusion that confidentiality should be breached when minors involved in a crime or serious offense and they don't understand it is a danger to themselves or other, or if the patient gives the permission of their information to be shared. And then there's some specific case studies that talks about to go along with these two. The first one is a patient that was 16 years old who struggled with severe mental health issues that affected their competency level, and they were involved in a serious offense and they weren't able to fully understand their case. So his counsel and therapist decided to ultimately tell his parents to help his legal situation in this circumstance. And then there's another patient who was 16 who was schizophrenic and told the therapist they had people telling them to harm themselves, which was a psychotic episode of hysteria, and it was determined he was a danger to himself, so the parents were informed, which was used in an effort to help keep him safe in this case, so that was him being a danger to himself. Overall, confidentiality is a very legal and moral issue when it comes to minors, especially with something as private and complex as mental health. And there's so many factors to consider, but the most important thing is definitely the well-being of the patient and how divulging this information is going to affect the patient. And ultimately, confidentiality should not be broken with a minor unless they are a danger to themselves, involved in a crime or event they don't understand, or if they give permission for their information to be shared. And those are my sources. So yeah.